Let's talk about migraine. So what is migraine? Migraine is a common neurological disorder characterized by unilateral pulsating headache, often associated with nausea, photophobia and phonophobia. So the acute treatment aims to abort or reduce the severity of the attacks. So migraine is nothing but there will be headache, which mostly it is unilateral. As you can see here, there is throbbing headache, and not just here, there can be pain around the eye also. So it is unilateral pulsating headache, and this can be associated with either nausea or photophobia या फिर phonophobia. ठीक है. And this is the classification of the drugs that are used for the treatment of the migraine, either to treat the attacks or to prevent the attacks. So in case of prevention, we have the propranolol, which is a beta blocker, amitriptyline, the tricyclic antidepressants, flunarizine, valproic acid, gabapentin, topiramate, erenumab. Okay. Then to treat attacks, we have the simple analgesics like paracetamol, aspirin, codeine. We have NSAIDs like ibuprofen, naproxen, diclofenac, mefenamic acid. Also we have the antiemetics like meclopramide, domperidone, prochlorperazine, promethazine, the ergoid alkaloids, ergotamine, dihydroergotamine, selective 5-hydroxytryptamine agonist, and these are important. So for the treatment of the migraine, for the specifically if we talk about the specific drugs that are used are 5-hydroxytryptamine, ergots, analgesics, antiemetics. These are most commonly used. Okay, so let's talk more about these 5-hydroxytryptamine groups: ergot alkaloids, antiemetics and analgesics. So the first we have is the triptans. Those are nothing but the selective 5-hydroxytryptamine agonist. Okay, shortly they are called as triptans. So the examples are sumatriptan, rizatriptan, zolmitriptan. As you can see here, sumatriptan, rizatriptan. So what is the mechanism of action? Mechanism of action is nothing but they are selective agonist of 5-hydroxytryptamine 1B/1D receptors. At the first look it looks somewhat confusing and complex. That's why I made this video where I had clearly mentioned all the receptors, 5-hydroxytryptamine receptors and their functions. So in this case he is talking about 5-HT1B/1D receptor. That means 5-HT1 under 1 we have 1, 2, 3, 4, 5 receptors. So B and D receptor is here. So it acts as an autoreceptor involved in the vasoconstriction and neurotransmitter modulation. Inhibits neuropeptide release in trigeminal pathways, important in migraine treatment. Okay, so that's why. So the triptans, they are selective agonist of 5-HT1B/1D receptor. Effects is vasoconstriction of the dilated cranial vessels. So what do? They do vasoconstriction. Why do we need vasoconstriction? Because the migraine is headache, right? And headache happens when the cranial vessels they get dilated. So if there is unnecessary dilatation of the cranial vessels, there will be headache. So in order to eliminate the headache, what do we need to do? We need to vasoconstrict the vessel. So that's what this receptor do usually. So we give the agonist so that this happens more efficiently. Inhibition of the trigeminal nerve activation, reducing neuropeptide release. So this receptor inhibits the neuropeptide release, which is important in case of migraine. So this becomes clear. Triptans, they work on the 5-HT1B/1D receptor. They cause vasoconstriction of the dilated cranial vessels and inhibits the trigeminal nerve activation, which reduces the neuropeptide release and then it releases the headache. Therapeutic use: first line drugs for the moderate to severe migraines. Adverse effects like tingling, dizziness, flushing, chest discomfort, and it is contraindicated in certain patients with ischemic heart disease or uncontrollable hypertension. Okay. Then we have ergot alkaloids, under which we have the examples like ergotamine and dihydroergotamine. So ergotamine and dihydroergotamine. What is the mechanism of action? It is an agonist of 5-hydroxytryptamine 1 receptor. So here we have 5-hydroxytryptamine 1 receptor. He did not mention whether it is A, B, D or anything. So he just mentioned it is 5-HT1 receptor and partial agonist of alpha adrenergic receptors. So it is an agonist for 5-HT1 receptor. Also it is a partial agonist. Okay, what does it mean by agonist and partial agonist? So in case of agonist, what does it mean? It means if agonist is a drug that binds to a receptor and produces its largest biological effect. Okay, so that is called as agonist or full agonist. And if we talk about the partial agonist, what does it mean? It means that a drug is binding to a receptor but only partially activates it, producing a smaller effect. but this agonist produces the full biological effect. Okay, so that's the difference between agonist and partial agonist. So it is acting on the alpha adrenergic receptors also. What does alpha adrenergic receptors do? In the blood vessels, they constrict the blood vessels, especially the alpha 1. Okay, so this causes cranial vasoconstriction and reduces the inflammation. So again he is talking about the vasoconstriction. Here also he was talking about the vasoconstriction. That means at the end we need to constrict the vessel somehow. Because it is dilated, it is causing headache. Therapeutic uses effective in acute migraines but less preferred due to side effects. So what are the side effects like? Nausea, vomiting, ischemia, and peripheral vasospasm. So as it is said, it does the vasoconstriction, but not just in the cranial or the head part of the body, but it also causes peripheral vasospasm. Okay, so that comes under the adverse effects and contraindicated in the pregnancy and vascular diseases. So already if there is vascular diseases, why will we give, right? Then we have the analgesics and NSAIDs. So best example is paracetamol, ibuprofen, naproxen and diclofenac. So as usual, how the analgesics or the NSAIDs work, they inhibit the cyclooxygenase enzyme, which reduces the prostaglandin mediated inflammation. Like what does this do? Cyclooxygenase, this is the enzyme which produces prostaglandin E2, D2, I2, okay, through the COX pathway from the arachidonic acid, right? And about the therapeutic uses, mild to moderate migraines or an adjunct in the severe attack. So at the end, this COX or the enzyme, this helps in the inflammation. So we are inhibiting the inflammation. Adverse effects is gastric irritation, renal dysfunction. Why is there gastric irritation? Because if we inhibit the COX pathway, then there won't be formation of the protective layer which is required in the gastric mucosa through the PGE2, I guess, PG prostaglandin E2. Okay, so that prostaglandin E2, its function is to produce the defensive layer in the gastric mucosa. Okay, so that thing is here. Then if we talk about the antiemetics, what do we mean by emetics? Emetics means ulti or the vomit. So examples are metoclopramide and domperidone. So these two are also important if we talk about the university exam. Metoclopramide, this causes something called as extrapyramidal syndrome because it crosses the blood-brain barrier. But domperidone, it does not cross the blood-brain barrier. Both of them act on the D2 receptor. They are D2 receptor antagonists. That means when they bind to the receptor, then the receptor does not act its biological function. So which reduces the nausea and vomiting. So D2 receptor, if we stimulate the D2 receptor, there is a chance there will be nausea and vomiting and the headache. But that's why we are giving domperidone or metoclopramide to block this receptor. So metoclopramide also enhances gastric emptying, improving drug absorption. Yeah, that thing, this is because of the cholinergic effect of the metoclopramide. Okay, therapeutic uses, we have adjunct to analgesics or triptans, and adverse effect is extrapyramidal syndrome, which is not seen with the domperidone. So this was about the migraine. Okay.